Live.
How do I extend that?
Here we are. We are live now
Oh,
with
okay.
with Dr. Chris. My name is Joseph Lucier, and I have the great opportunity to introduce you all to someone who's brought wheatgrass to the next level of healing. He's from Australia, and he's going to give you his story. I'm going to let you tell it in his own words, but I know from my personal experience with my own healing practice, I've used these wheatgrass products with different people with amazing results. So with that said, I'd like to introduce Dr. Chris from Australia.
And
And we are ready to go, Dr. Chris.
sorry, it's 9 o'clock in the morning here, and so I'm sorry to keep you up so late, but it's a great pleasure to be here. It's an honour to be here, and it's I must admit because I've been working with American patients online, and I've got an online practice, if you like. And by far, I have more patients probably in the United States than I have for the rest of the world. And so it's always a pleasure to work with Americans because they put everything so clearly, and so it makes my life a lot easier. And they send me pictures, but I've been doing that now for 20, probably 10, 15 years. And so it's a real honour for me, and also it's I think it's to do basically with the fact that the wheatgrass fad, as it was back in the 1950s, came from America, and people there are much more wide open-minded to actually show an interest. I think not just in wheatgrass, but in all alternative therapies. I've only stuck to one because I'm a sort of mixture of an allopath and homeopath, and I don't know what you call that in between. But it's certainly been quite a journey for me because perhaps I should go back a little bit, bore you with my bit of my history. But I was actually born in Perth, Western Australia, and where not many people were when I was born. And my father was a sea captain, and my mother wasn't. She stayed at home with 3 kids, 3 sons, and had to look after us. I was born in the middle of the Second World War in 1941. And my mother's aim in life was to have at least one of her children follow in her husband's footsteps. Well, my oldest brother emphatically refused. My middle brother wasn't quite sure. And I jumped at the opportunity because I thought I could go see a bit of the world. So at 16 years of age, I took off on a British ship, merchant ship, to Liverpool to be what we called in those days midshipman, or it was basically a cadet navigator. But we ended up doing all the dirty work that the seamen wouldn't do, which did me a world of good. I got my hands dirty, and I got used to that, and I think that helped me a lot later in medicine, not from the dirt point of view, but the fact that I was encouraged to use my initiative. And that was, I think, very helpful in my future life. But I left to sea. I came home after 5 years, and I joined the West Australian State Shipping Service that my father used to work in when he was a captain. His ship was actually bombed and sunk by the Japanese off Wyndham, which is just south of Darwin in the Northern Territory. And there were 200 people on board, and he was the first officer. And the ship eventually sunk, and there was a court case, and I think that that dragged on a long time for my father, and I think that had quite an adverse effect for him. But he'd never talk about it, so I'm not really sure about that. So I followed in his footsteps, but then I came home and I got rather fed up with the attitude of the, just the how would I explain it? It was in those days there was a lot of almost militant type problems with staff and things like that really got to me, and I eventually, just by pure luck, I was talking to the chief engineer, who was my sort of my mentor, and he became a patient of mine actually later on. And I told him, I said, I had to get out of this. And I said, he said, well, what are you going to do? I said, I don't know. I'm going to go ashore and I'll sell vacuum cleaners. I don't care. But I have to get off the ship and do something else. And he said to me, he said, why don't you get a degree? And I said to him, centigrade or Fahrenheit? I had no idea what he was talking about. I left home at 16. I didn't, really worry about anything else because I was going to see the world. And I knew I didn't even know what a university was for. And so he said, no, he said, what do I study? Arts? He said, no, don't be stupid. He said, you study medicine. And I said, what does that mean, being a doctor? And he said, yeah. I said, well, I'll do that then. So that sort of changed things quite a lot. And it wasn't easy. I got married and 2 kids and no money all the way through my course, but I still managed to get through. I just got pipped for the medical prize, but that's okay. I don't bear grudges. And when you look back, you realise that it wasn't quite so important after all. So anyway, I was in general practice. Do you call it general practice in America? Same thing. Yeah, I was a GP for a number of years, but I sort of always got that feeling that I wasn't. Because I always dreamed I would be able to heal things. If you study in medicine, you'll come out healing, but I wasn't. I found that there was many areas in medicine, like wound healing and infections and things like that, burns and all sorts of other conditions. There was really nothing available that actually, for instance, in burns, stopped a patient's pain or prevented infection. And there were many things like that. And I think after a while, I sort of lost interest. And I took a job over in Hong Kong for 4 years, working for the International Organization for Migration, which is an American organization, as I'm sure you know. And we were, I was doing literally thousands of medical examinations of Vietnamese refugees, and we were resettling these people in all around the world. I did that for 4 years, and then I was offered a job in Moscow. And in retrospect, I foolishly took it because it was extremely dangerous. It was in the Yeltsin era, and it was very dangerous in Moscow in those days. But after a year, I managed to get my wife and myself out of there. And one of these days, I hope I can go back and see it through different eyes. So then I came home, and I didn't. I went back to general practice. I tried different jobs in healthcare and community health and things like that. And then my wife suggested we go and live in Melbourne. And I said, well, okay, but the weather's much nicer over here, but that's all right. So we took off to Melbourne. And that's when, as I say, I had no interest in herbal medicine or whatever. And I'd only just started in this clinic in Toorak in Melbourne, near the centre of the city. And an elderly woman came in, and she was she'd had a broken arm, and she'd fallen over, but she'd had also, it was 3 months, 4 months before, and she'd been on narcotics, she'd been on all sorts of things, and nothing would stop it. And she was so depressed, she was suicidal. And I said to her, I said, well, why did you come in here? And she said, well, I heard there was a new doctor in the clinic, and I thought you might be able to do something for me where no one else could. And I said, well, that's very nice of you, but there's really nothing I can do for you. And she was on antidepressants and all sorts of drugs and things, and it was just, but I just felt absolutely helpless. And that's not a good place to be. But and I started visiting her a couple of times a week just to try and cheer her up a bit. And then one evening she came back with her husband, and she'd changed. She was bubbling. She was laughing and carrying on. I said to her, I said, what the devil happened to you? We don't normally talk to patients like that, but well, maybe I do, but she said, I found this marvelous cream. And she said, I rub it over the fracture, and in about 10 minutes the pain goes. I said, lady, you're talking to a doctor. and her husband was saying, it's true, she said she sleeps for about 4 hours, wakes up and puts it back on and goes back to sleep. I said,
oh, that's amazing.
Pretty clever, hey. I look back at that and I think you patronizing sod, you don't talk to patients like that, but that's how I felt about it. I was trained. We were encouraged to use drugs. That was, and what we knew about the drugs, the side effects and the biochemistry of it all and everything was all very good. But when it didn't work, or if the side effects started getting affecting people's quality of life, you have to start asking a few questions. And that brought me down a lot. It dragged me down because I always felt I was maybe doing the wrong thing by prescribing a certain medication. Anyway, I said, oh, well, if you have such a wonderful thing, I must learn more about it, patronizingly. And that led me, I was introduced to a ryegrass extract. And that part of I went from there to working with two brothers who were trying to get this extract this cream off onto the marketplace. And I did. I worked hard. I tried it on many patients, and that was what she had been using. And things didn't work out because, I could go into that, but I'd probably end up in court if I did. But the fact was that I worked for them, not for them, but with them, if you don't mind. Sorry about that. I started using their product on different things. In fact,
yeah.
The very first time I used it was, one of them came around to see me,
mm-hmm.
and he showed me a photograph of a horse with an infected wound on its fetlock. And the vets had been trying to heal that for 9 months. And it was a very expensive horse, a racehorse. And they were about to put the horse down. And they gave him a liquid extract, a bit of the liquid extract, and said, spray it on the wound and it'll heal. Well, that's to the trainer. And the trainer said, well, yes, it sounds exciting, but I don't think it's going to do much. But anyway, he did. He waited on the horse and called him back, and he said, well, you'll be glad to know the horse bolted and we won't see him again. He's over the other side of the paddock and he won't come back.
So this was
And
also a wheatgrass, or the wheat
no. This was another. It was another
extract.
brand, but that's finished. That was finished a long time ago. And the next morning, the trainer rang and said the horse is back. And he said he stood there. He stood there while I sprayed the stuff on, and he didn't bolt this time. And the wound healed. You know, well, he knew it was healing because the flies stopped coming.
Oh, great!
Very basic, you know. This is clinical veterinarianism, you know. But that's what happened, and the trainers couldn't believe it. So it saved the horse's life, and as far as I know, it went back. So that's one of these gentlemen came around to see me, and he left me with a tube of this cream, and showed me these photographs and all that stuff. And I said, yeah, well, okay, you know, and I'll give it a try. Very patronizingly in retrospect. And as I've been treated numerous times since by my colleagues or by some colleagues. You know. And so I put it in my bag and forgot about it. Anyway, it was a couple of days later, I was in the clinic, and the receptionist said, oh, can you go and see Mr. Smith across the road? He's in a lot of pain. And I looked around the waiting room because there were 7 people waiting. And I thought, well, yeah, well, okay, well, I'll just drop everything and go and see if he's right. If he's in pain, I better go. Because I was on single-handed that day.
Okay.
And I went over there and I found my way upstairs to his room. And he was in his 80s, and he was an ex-bookmaker. Do you call them bookmakers in America at the races?
Gambling, yep. Gambling stuff, yep.
Yeah. We call them bookies. You know.
Yep, and we got bookies.
And anyway, he had an ulcer on his lower limb, his lower leg, and it with a thick scab on it. And he was on all sorts of drugs and medications and things like that. But he had a good sense of humor, like you'd expect from a bookmaker. And he was ironic sense of humor, you know, which I tend to sort of appreciate. And he said, "This wound's killing me, doc." He said, "Can you fix it?" I said, "What do you think I am?" You know, sort of, that you should be in hospital. Because the nurses were coming around and cleaning off the scab and sort of working it up. And I said, well, you know, it really needs to go. You have to go in the hospital. You can't do this at home because you're going to be doing it 2 or 3 times a day. He said, Doc, he said, I'm nearly 90. He said, I'm going to die soon. And when I die, I'm going to die here with me missus. I'm not going to the hospital. I'm a GP. So what do you do, Doc? And I said, then I suddenly had this idea. I said, Alan, I said, you're an ex-bookie. I got stuff here that works on horses. It might help you. And I was saying this, thinking to myself, Reynolds, you can't say this to people. You know? But we had the same sense of humor. You know, we were able to sort of. I mean, I talk to people and sort of say, "Oh, you're going to be okay." You know, and he said, I don't care what you put on there, but as long as it stops the pain. I said, it's not going to stop the pain. He said, but you never know. It might help a bit. So I was very curious that night. I sort of thought, well, what's going on? I was thinking of this woman with a broken arm and the horse. And I said, next morning, I went upstairs, and there's Alan sitting up in a chair reading a book. He said, G'day, Doc. How are you? He said, what's the matter with you? And I thought, something's happened, you know. And I couldn't believe it. I said, well, let's have a look at that wound. And we took the dressing off. The scab had completely disappeared.
Wow.
It was thick. It had just completely disappeared. and the wound wasn't even weeping. It was sealed over. I could see it. I got a torch on that, a light on that, and I could see that it was a very thin layer formed over the surface of this.
It was healing, yeah.
I thought, this doesn't happen. Well, you don't. You just don't see things like that. Maybe you do, but we don't see that. And certainly, I'd never seen anything like that. It's a miracle in that sense,
Mhm.
you know. And when I looked closer, I got a magnifying glass out and had a closer look at it. I could see, with the light shining on it, that the whole surface of the wound had sealed over. A very fine, very thin layer of new cells, I presume. And you never see that. It just sealed. It was a large wound, and it seemed that there would seem to be epithelial cells starting to appear on the surface, little dots of them all around. You know, I had a pretty strong light, and I had a pretty strong magnifying glass, and I just couldn't believe it. And he said, yeah, he said, and by the way, he said, just after you left last night, you put that stuff on. He said, the pain went. He said, I had a bloody good night's sleep for the first time in about a year, you know. And I said, stop it. You know, this is too much. And he became, in a sense, a guinea pig, because he was willing to try anything else because he had everything wrong with him.
Sure.
And so it went on from there. And well, I started thinking, and I started using my imagination, thinking, well, how can I use this for? Well, I'll try and use this on different things. It's perfectly harmless. It's healed his wound, and then I started getting, other many conditions. I could talk about this for about 3 years, I think, but I don't want to bore you too much. And one of the then I started seeing all these healing phenomena. Again, things that aren't in the medical books at all. And one night, a woman came in with it wasn't long after that. It was winter time, and she came in, and she was 27, and she was she worked at the local casino in Melbourne there, and she was white as a sheet. The temperature was about 30, well, it was well over 40 anyway, and rapid pulse. To me, it looked viral, and normally I just give them some paracetamol or something like that and write them a certificate. She said, I want to go home and die. Can I have a medical certificate?
Wow.
Well, you have to react to that, I think, although there's not much you can do. And I knew there wasn't anything I can do. And then for some reason, I'll never understand why, but I said to her, because I had some of that cream there, I said, do you mind if I rub some of this cream on the back of your neck? And she looked at me in a rather sort of fearful way. And she said, well, no, I don't mind. And I'm standing there putting this on the back of her neck, saying to myself, Reynolds, this is too much. This is going too far. You shouldn't be doing this. And to this day, I have no idea why I did it.
Good intuition.
Huh?
Good intuition.
Well, I don't know what you call it, but yeah, I think it was strange. It's something I've never worked out. But anyway, she popped her up in the couch. I had a look at her. She had a fever and a rapid pulse. That was it. Everything else was fine. And anyway, she hopped down and she sat in the seat next to my desk, and I started writing the medical certificate. She said, Doctor, what is it? And I turned around. And I turned around and looked again, and her face was gone from white to pink.
Wow.
And she revascularized. I mean, this sort of blood's come up from somewhere. What's happened, sort of thing. I said, what is it? She said, well, I don't know what that is. She put on the back of my neck. She said, but I feel better now. I don't feel hot anymore. And I felt like crying and saying, this is too much. I'm getting too many of these things. But she said, I don't really need that certificate. And she was
Oh,
normal colour. And because I'm in the middle of a busy clinic, there must have been 7 or 8 patients waiting out there. And I had no one to talk to, no doctors or anything. It was one of the loneliest moments of my life. What the devil has happened here? I've got a good idea now what happened, because
yeah.
I've been with it for 25 years, longer than that now. And although I don't use the ryegrass, I use wheatgrass. There's another story behind that. Well, I took that on because it's much more effective, and also uh, the science on wheatgrass is vast, but very, very little available for ryegrass. So I went specifically for that purpose.
Maybe you can explain that to people that are listening, because I think a lot of people in the audience, and I still want to get to your slides because I think those are so important. But if you could explain to them exactly, because a lot of the people in the audience think, oh, you're talking about wheatgrass shots or rye shots or something.
Oh, sorry, no, yeah. I'm just talking about a wheatgrass extract
Okay.
I use. That goes into the products that we make. But you can use, that's the beauty of this. If you had a burn, and I don't want to get into the commercial side of it, but you can use, if you had a burn and you didn't have the cream or the spray, you can use the shots, because it's the extract that does the work, nothing else. And
And I think that's critical for people to understand. I just want to make sure they get your message, because
yeah, no, that's fine.
I've
Yeah.
been I've been looking at your stuff for many years and using it in my own clinical practice. But in terms of the application, you went from rye to wheatgrass because it's better, and then you also went from, say, conventional wheatgrass, which is a juice, but you actually have an extract, which is very therapeutic. And the products you have are basically an extract shot. There's also a balm, and the super balm, which is the one that I use with my patients personally, like with quadriplegic, which is one of my most memorable patients that I use this for, to help them. So am I understanding that correctly?
Sorry, well, saying what? I'm not quite sure what you
So,
meant.
but basically, your application is using a wheatgrass extract, which is better than the rye, which you started with, and you have it in sprays, balms, and
Yeah.
a drink.
No, I know what you mean. Look, I'm not a chemist, and I'm not a manufacturer, and I'm not a businessman. I just fiddled around with the extracts and different things and worked. I spent a lot of time growing my own stuff and testing it and things like that, going through the literature and seeing what I could find. But I found that the wheatgrass, I think you can say one's better than the other. But
Yeah,
when you've got more research behind you, you feel more confident when you're stuck out there as a doc trying to tell people that this is going to help them. But yeah, so I'm not quite sure where I got to yet. But
but I think the bottom line is you applied it in the examples you gave so far. You applied it to the woman in the back of the neck, which is amazing.
yeah, well, I started using it. See, I used to do a lot of house calls and stuff.
Oh, right.
But yeah, and I saw so many rapid responses that things that you don't see often in the surgery, for instance.
Wow.
And I had one elderly lady with reflex sympathetic dystrophy, which probably I hadn't really seen before. And she had a black arm because she'd had an older nerve operation. And the injury actually deadened her from the elbow down to the
Wow.
hand. She couldn't move her hand. Her arm from here to there, it was black almost. It was just, devoid of any circulation. And I tried to asked her. I said, "Do you mind if I put this on?" And I used just a toothpick. I only used a small amount of the thing, but I ran it along the back of her hand. And as it touched the skin blanched. And as I ran it up her hand like that, it blanched all the way up.
Wow.
Well, to me, something's happening.
Absolutely.
Yeah. To my colleagues, I'm imagining things. So it seemed. Well, I've been imagining things now for 27 years, but I've imagined a lot of things, but they're not imaginary at all. They are actually things that have occurred, and that's what I've got on my website. That's just like a minute amount of cases that I've got on my website. I've got thousands of them, and many of them are most of them actually from overseas or from my online clinic. So it's very useful being able to treat somebody in India for a leprosy ulcer, which
Wow.
we can also heal. And we're doing a study, or just a brief study at the moment. We're actually getting healing of leprosy ulcers with one application. And this is all helping me to understand how this stuff works, because that's what's driven me from those first days, that first with Alan with his ulcer. How did this happen? But now I'm getting there.
Okay.
Thanks. It's only 27 years down the track. But call me a slow learner. I don't care. But I've gradually got there, and I can die happy. I feel I can leave something behind that's going to be useful to a lot of people. And I think you've already said you've noticed for yourself that you get some quite amazing responses from time to time.
Yeah,
sometimes it doesn't work. For instance, for people with with conditions where there's no return, there's no ability to get back to the central nervous system, to the brain.
correct.
Then you're not going to fix it. I've seen stroke patients come back very quickly, but over time, as this gets gradually worse up in the brain, you find that their ability disappears. Well, you can't do anything after that.
I think that's a really important point that the people need to understand. Even if people have strokes or some really serious injury, if the nerves are still available, the balms and the sprays and even the extract can help to bring it back and to, in many ways, regenerate and reactivate the nerves. Was that a good assessment of it?
It's just the extract. It doesn't matter whether it's in water or liquid or solid or whatever.
Right.
And I'm pretty sure now, this might be a bit premature, but I'm pretty sure now that, and I'm a bit of a slow learner, because I should have spent more time in academia than in the doctor's surgery. But I think that's where you learn things. But it's pretty clear to me now that what happens, excuse me, is we know for a fact that there are many ligands in the extract that we get from the wheatgrass, which in other words is in the wheatgrass. And I've got thousands of clinical observations that I can go back to and see. And after a while, I've been able to almost predict what to expect.
For our audience, can you explain ligands?
Well, ligands are molecules that bind to cell receptors, and our body's covered in, and we have billions of these receptors throughout our bodies, and like pain receptors, nociceptors they call them. These are all over us, inside and outside us, to perceive pain and signal that to the brain. And I think that's a good place to start, because we know that substance P is the transmitter, the neurotransmitter of pain from a receptor to the brain. And we know that from these studies by the laboratory is the inhibition of substance P is close on 100%.
Wow, that's amazing.
This is something that you're going to see, and this is probably the most important thing of the extract. I shouldn't say wheatgrass. I think it's the wheatgrass extract.
Okay.
Because that's very, very potent. Clearly it is. Obviously it is. I don't need to have, double-blind standards as studies with 3,000 patients to tell me that somebody's pain has suddenly disappeared,
Right.
especially if they've just spilled boiling water over themselves.
Okay.
So you get this stuff on quickly. It can stop that pain or ease it, and will stop the blistering or reduce it. But there are so many, it's such a broad spectrum of bioactivity. There's about 20 of these ligands that they've discovered, and that was back in the 1980s,
Okay.
when those tests were done. So we don't really know how much more there is to find here, but I think it's an awful lot.
Did you want to maybe I can show some of the slides for the audience?
Yeah, fine. Yeah, if people want to know about that, or show what we can do or what it can do, that would be very helpful.
Yeah, because they can see the real deal in the slides themselves, and then you can give the examples. I mean, the examples you've given so far are excellent, but I think everybody needs to understand that this is amazing healing quality and amazing healing potential from real experience,
Yeah. Got to turn my head very, very rapidly and very strongly. So
yeah. So I think.
Do you want to start at the top?
Sure, I can do that for you. I can start at the top. And these are actual real cases, real people that have been benefited from these types of situations. So here's one example. And
Yeah, sorry. Yeah,
I'll change the slide whenever you want. Tell me.
No, that's all right. That's all right. If you're happy to work down the list.
Sure.
Yep. Just don't go to sleep. That's all.
No way.
All right. This is molluscum. I think we all know what that is. If we've had kids, we certainly would know what it is. It happened to me, actually, because one of my kids got molluscum. He was about 4, I suppose. And I just spotted them, and I said, well, I better put some of this grass on, because it's not going to work. But I was trying it on everything.
Oh, great.
And he was covered. It was much worse than this, actually. And then I forgot about it. And a couple of days later, I said, let's have a look at those spots, Michael. And I couldn't find them. and I said to my wife, she was a nurse, and I said, I don't believe this. It's just gone. I mean, there's nothing out there that works for molluscum. Well, there are things out there, but which I never actually tried, because I had reports from patients that it didn't do anything. And molluscum is it's a condition that a GP sees and says, well, you're right, you got molluscum. And that's about as far as you can go. I know there are quite a lot of medications or herbal remedies out there for molluscum. I think a lot of them work. But this is just to show that what we've got here is an antiviral response. And so it looks like the grass has triggered that response.
Wow.
It's not the grass that's actually doing that. And this is what I was saying. I've spent 25 years trying to really figure out how ultimately how this stuff does work. And it has to be a reason for it. But I couldn't find anybody in the medical profession that was willing to sort of even share it with me, you know. So it was sort of a, I'm sure it wouldn't be like that in America, but you know, things are a bit different out here, I think. But anyway, so that was that case. So
Okay.
can we go to the next one?
Certainly.
And this shows you this is a classic example of how rapidly the grass can work. The extract, I should just say the extract, really. I'd met this man. His wife was a nurse, and she from Western Australia, and she rang me up and said, because I'm in the eastern states now. I live in Queensland, and she told me about her husband. And I said, well, she said, is the grass going to help? And I said, yeah, of course it will. You know, so she did. She put it on, or he put it on. He went down to Perth because they were living up in the bush in north of Perth, and that's what happened. He was a farmer, and he was a very tough farmer. And she said she didn't know anyone so tough as him, but he was crying with the pain. He said it was just, you know. And so you can see here. How do I? Well, the first picture you can see there, 3 days after. But what we've got here, just in just over 2 weeks, I mean, you wouldn't know he's had radiation treatment there. How has that happened? Well, how it's happened, as far as I'm concerned, is that the grass, again, has signaled this process or this problem up to here. It's reconnected. We want to have to ask oneself first, he was having a cancer removed from his axilla. How did that cancer arrive in the first place? And I think what happens is that the brain sort of controls everything, and that connection between the brain and all the other parts of our body, those connections are extremely important. Mm-hmm. And if they go awry, then things start to happen on the skin or in the gut or in the heart or in the lungs or whatever. And much of the way that wheatgrass works, I think, is it reconstructs or realigns that connection by the ligands that exist in there by as I said, with pain reduction with substance P as one ligand. It blocks the passage of pain. It stops it from getting to the brain, right? But the brain is forever connecting with the periphery. That's what it does. It's controlling everything, but it's doing it all in one hit. It's a pretty clever organ up there. And when you think about it, and it's 24 hours a day. They don't get smokers or anything like that. They just keep working. And I think that there's a lot of what we call autoimmune conditions due to this breakdown, this connection with the periphery. And like in psoriasis, I've had there is a psoriasis case. I don't know can you see it there? It's further down. I'm not sure which that is. Getting there. Keep going. I think it's probably right at the bottom.
That's okay. We'll find it. There you go.
That's it. Sorry, I should have put it further. I didn't know you were going to ask me this early. But anyway, this man, he's from India. I run an online clinic, a free clinic that I've got patients all around the world, and I get the most extraordinary cases thrown at me. And this gentleman had, as you can see in the left there, the thick plaque. That's very thick plaque. And he's had this problem for probably 5 or 10 years. And as you can see, after 2 applications of the wheatgrass, and this was over about a month, you can see that there's on the other one, the other arm, the other picture, his that thick plaque has virtually disappeared, and underneath you can see there's new skin or normal skin. Can you see the spots here? How do I forgot about it. I didn't think of this. Oh, there we are. Can you see the pointer? It
Whoops.
wouldn't work from my thing, would it? Yeah.
Oops, sorry.
Yeah.
Hold
But
on.
you can,
Yeah, go ahead and continue on. I'll just get this reset up for you.
okay.
One
But
second. You're free to talk. I'm going to set this image up again
so the
for you.
question is, how did the psoriasis get there in the first place? I don't think anyone's ever told us that. You're right. Please don't tell me. Yeah. Sorry.
We'll just get that picture back for you right now. Here it comes, and there you go.
I'd rather look at the picture than look at me, you know.
Share screen. It just, for some reason, it jumped out of us.
Right. Anyway, well, I've shown you where you can see where a lot of that plaque has just disappeared, and that's in 2 weeks.
Mm-hmm.
Well, normally you're treating with psoriasis, you're usually looking at a lifelong problem, right? Thanks for that. Yeah, that looks good. That looks really good.
There you go.
And but you can see these areas here. I know it's hard, it's difficult, but I didn't take the photographs. But you can see how the plaque, all up here and down here, is thinned out. You know, and you can actually start to see new skin underneath. It's like it's being peeled off. That's not the wheatgrass is doing that. That's the brain doing that. I'm sure of that.
Okay.
Because I'm talking about many thousands of patients with many, many different conditions. And there's always this sort of pattern that I've started to see happening over those years. And after a while, you can be fairly confident, not cocky, but fairly confident with your patient and say, yes, I think we can do something about that. And some of these cases, you don't get much response at all. But you do see response almost in all of them very quickly, where there's a color change, like in psoriasis. Well, you don't get that with drugs and things, with steroids and stuff. I mean, steroids just damage the skin, basically, and it quietens the inflammation down. And it can do a lot of damage. And I've been sort of, I used to plaster it on people, you know, pre-grass, because that's all we had. And they're still using it to these days. And those topical steroids do an awful amount of damage. And they're putting them on babies. I sort of really just don't think that should be happening. And so it's it's not so much the improvement here, but the phenomenon that I'm seeing, and it's overnight, basically in 2 weeks. You never see that in psoriasis. It takes months and months and months, sometimes years, and often a reaction to the drugs that are used, etc. The surrounding skin, the normal skin, is damaged, and I think that basically most of the drugs that are used for this are just to control the inflammation. You don't get any healing, and that's the key. That's the key difference. I'm probably going to get a lot of trouble over this, but never mind. But I think when you've worked with it and you know pretty well how things are going to go, and you can explain that to your patients. Sometimes it doesn't work at all, but that's because that connection just hasn't been made, that reconnection. And so. Do you want to take us on to another one?
Certainly. Let's see. You want this one or this one?
Oh, well, that one before, just to the horse. Yeah, that's a horse. This is from an American lady in Mexico who runs a horse. I don't know what you'd call it, a horse hospital. But for straying horses, or stray horses, And but this she loves our stuff because of this. I mean, this sort of thing. And I've got all sorts of cases from her. And I think you just see there from what have we got from at 7 weeks, you've got this massive wound. The horse bumped against the wire fence, ripped its skin off. But in 7 weeks, you've got not only a much smaller wound, but look at the tissue around here. It's all the hair, the fur has returned, right? Normally you get scarring from this sort of thing. And if you go right down here at 18 weeks, the thing's completely healed. And if you look around at the fur, but it's come back, and all you've got down there now is a scar, a small scar. Now, she told me herself, she said, this just doesn't happen. And I said, well, I was expecting you to say that, because this is, especially in animals, it's, the grass, I mean, I've seen extraordinary things, but like I've seen in humans. So probably in all in the animal world, it could make a significant difference to the healing process. To me, it's a game changer. As I say, after 27 years working with it and trying it, and as I say, it's something you can drink. So I never have any concerns about prescribing it. So have you got another one there?
Yep. Would you like this one?
Yeah. Well, here's another one. You see, this is the thing that we did a study in India. We had a man on the ground there we got him a motorbike and a camera and a laptop to send these films back to us from India. And he's a PhD. He's a great man, actually. He's about 6'4", but he's greater in many other ways, because he worked with lepers for 30 years just as an assistant to help these people for nothing. And that's the kind of dedication that Rajan is. He's an amazing man. But leprosy ulcers don't heal. And this sort of also backs up what I've said earlier about the dosage. Not less is best, because at this time we were actually treating these ulcers 3 times a week, and some of them healed, probably 15% actually healed, but the rest were leaking and just not getting any better. But I understand now, years on, because this must have been 12, 14 years ago, 50, yeah. And I think we had about 20 people in the study, but only probably 15, 20% had significant improvement, which in itself is unusual, because there's no real treatment that heals the wounds in leprosy. They can get rid of the bacterium, but healing the wounds is another thing. And amputation is sort of so frequently the order of the day. It's horrifying. And we're actually doing studies at the moment now where we've changed our regimen to one treatment. And you know what? They're all healing. And they're all healing quicker. Yeah. So this is what I'm getting at. To me, you're only going to get that if you can tell the brain that there's something. It's that brain that is controlling all this. We've reconnected that. It's not the grass at all that's healing it. It's reconnecting it to the brain. I mean, you can take that or leave it. I mean, I'm not trying to sort of push it to anybody. I'm just saying this is the way I see things, and I can't think of any other way that it could be happening. But when you've got studies like we had from the Rhone laboratories in Paris, with there's ligands in the number of ligands there, it accounts for a lot of what's happening. Getting this restoration of the proper physiological status of the thing, and we see this in leg ulcers. We see it in, well, as I cut it back, I reduced it and just made a single signal or a single signal just from time to time, once every month or couple of months, etc. I'm still trying to find the best way, and things do improve. I suppose just experience after a while. You're able to make these decisions and help these people. And to me, it's very, very gratifying, and I consider myself to be a very, very fortunate doctor. So that's my little bit.
I think that's kind of one of the things that inspired me about your work. That you are gratified by the fact that you can help people sincerely and dramatically, as we're doing. What I'm thinking is maybe we can do one more case, because I think these are awesome, and then we're going to go into our questions and answers, and then see if we can get more. So let's see, which would you like here?
I think that one.
Okay.
Because that's a funny one.
All right.
we'll finish on a light note. No, I used to be a doctor for a football team down in Victoria, and a friend of mine was a trainer there, and since then he uses our stuff all the time. He actually sells it. But I used to go to the games, and this man got kicked in the head, and he was sort of reeling around the thing. Somebody asked me to go and see him, and I went out there, and this thing is up like a balloon. It was much bigger than what you can see there, and I just said to him, "Can I rub the balm on?" He said, "Yeah, go for it, doc." And I put it on, and I said, "You better come off." He said, "No, I'll be all right." So I thought, yeah, he must be a footballer. So he was, they're pretty tough. And that was the next morning. I went straight down to the ground because they went down there for sort of post-mortem, and that's where he was. The swelling just disappeared. Well, you just don't ever see that. You can put ice on it. Ice shouldn't be used on wounds or injuries or anything. Should never be used. But I can't remember his name now. He's a famous American sports writer. He agrees with me. But I'm 80 now, so I'm having a bit of difficulty pulling the memory strings, if you don't mind. And so he went back on the next. He stayed on. I thought he was a fool, but he knew better, so that was it. But he came up smiling. So anyway, that's just shows you don't put ice on a wound, and you shouldn't use ice on anything because it slows the blood what do you call it? It stops the blood flow, slows the blood flow.
Mm-hmm.
They should be putting warm things or wheatgrass on it or similar. And there's probably plenty of herbal remedies out there that would actually do that. I don't know. It's not. I'm a bit one-eyed about this. You probably noticed, but I haven't gone any further than that in terms of because I don't practice medicine anyway in real life, except online, and usually I'm dealing with things like amputations or threatened amputations or leg ulcers that are infected. Particularly diabetic ulcers.
Okay.
And which we've saved many feet with the extract over the years. But I've learned there not to use too much. once a month for an ulcer, any kind of ulcer. You don't need to keep the way I use it, the way I see it anyway. You don't need to keep telling the brain. The brain has a hell of an ego, I've discovered, and it just doesn't like being told more than once. I know it sounds silly, but but if you use that as your means of assessment and treatment, you'll start to find things heal a lot quicker. It's all contrary to what we're used to know, or what the way we see things. But if you go to Eastern Europe, or you go to into Asia, to other places, you'll find that these herbs are used all over the place. Look at India.
Mhm.
They've been in, and Ayurvedic medicine has been, wheatgrass has been part of it. You go to India, there's pots of wheatgrass growing all over the place. I was astounded when I went there, and but I think they're using too much.
I think that's really important for people to understand, because when we began, you talked about homeopathy, which is really kind of it sounds a little bit similar to what you're mentioning. Less is better in that aspect. Yeah.
Yeah. It's well in front of allopathy. I think there's nothing in modern medicine that heals. Do you know of anything? I certainly don't.
No, and I think this is quite profound, because, as you repeated, it's not the wheatgrass that's doing the work. It's the wheatgrass is reconnecting the brain to the healing site. And I think it's really important for people to understand, because the power of our brain reconnecting to an injury is more powerful than, say, like you say, steroids or ice packs or medications and drugs. Does that seem like a good?
That's exactly it. It took me a long time to realize that, but we're trained like that. And I think culturally, that's the way we've been taught to understand things. I don't think anyone's to blame. It's just the way things have developed. And I just tend to go along this track because it works.
Yeah, it works, and it works really well. I mean, from my
It saved
experience,
a lot of lives. Believe me, a lot of people with diabetic ulcers, people with gangrene, or not with gangrene so much, but certainly with ulcers, are suicidal when I meet them. And we saved their leg. And have you ever heard of Dr. Hegde in India? He's a very famous physician.
nope.
And he's on TV and everything. But I met him years ago when I first went to India, and I had no idea who he was. But he had held a lot of sway, and he was backing me in helping heal diabetic ulcers with the X-ray in a hospital in Chennai. And I went over to meet him, and then the next thing I knew, they invited me back to be the guest of honor of their annual hospital event. And I said to him, I had to give a talk and all the rest of the stuff. And I felt greatly honored by this. And I said to him after dinner, I said, "Why on earth did you invite me over here as guest of honor?" And he's sitting there, and he says, "I will tell you why." Because he's like that. He's like that. He's a real character. You should look him up on Hegde. Hegde. He's a very famous man. He's in his 80s now. He's almost as old as me. Sorry, I'm almost as old as he is. He's still got his brain though. But anyway, he said, "I will tell you why." He said, "My best friend had an ulcer on his foot, diabetic ulcer on his foot. And he said, I did what you told me to do. And I went to his house twice a week, and I put that extract on his thing and put a dressing on it. And it healed, and it saved his foot." And he said, "That's why you are here."
That's great. What a great story.
I've had the most incredible journey with this stuff, really, because it's just it's just amazing seeing people respond. And that's the thing. I guess as a kid, I was like fixing things, but I still enjoy that. And but a lot of the things you know, I haven't shown you here, but they're really quite some very serious conditions.
What
You've
I'd
got
like to do, yeah, and in terms of the audience too, they have a lot of great questions because they're glad that they can meet you as well.
Well, you better tell me to shut up, Joe,
No,
because
no, no, I'm not gonna.
once you get me started talking on this stuff, you know,
No, I think it's great. I could listen to you all
my
night.
wife goes running. You know.
But here's a few questions here. The first one is because people want to know practical things. For example, how much to use, when. Like I say, it seems quite profound. Using less is better. So the first question is, what are the effects, say, on blood? And this might be in particular for blood that people have, say, ITP or bone marrow issues, blood or leukemia. So those types of things. How would it affect blood generation? Is that an option with your wheatgrass concentrate?
Well, then again, you see, I think we have to look at the reconnection essentially with the central
Okay.
nervous system. And on my site, there are I can't remember how many, but there's certainly children with leukemia. I honestly, from memory, which is fading rapidly, you'd have to go to my website to answer that question. That's the Wheatgrass Healing, wheatgrasshealing.info is my non-commercial site where I talk about these things, or you can send the message. I'm advertising now. Sorry, but you know, you come to me and I'll answer your questions as best I can. I don't charge anything for it, and I love what I do. So, you know, anytime. And but
I think that's interesting because my story is I was sending questions to your website, question to people, and all of a sudden I looked up and I says, "Wait a minute, this is Dr. Reynolds responding to me." That was pretty cool. So I felt pretty pretty lucky. But in terms of the say effect on the blood, like you say, the aha moment, as we have here in our comments, is the fact that the wheatgrass is reconnecting to the brain, to the injury site, and that's where a lot of the healing comes from, and that actually does a lot of the work. So in terms of say blood or leukemia, or say the application. So those would be a couple of questions right now. One would be about, say, let's pick ITP, and idiopathic thrombocytopenia and leukemia, similar types of situations. Can you give us some more information on that for us?
on
Say,
what?
the effect of, say, the wheatgrass concentrate on helping a situation where maybe platelets or white blood count is deficient, and then eventually can turn into something like leukemia, which is again a marrow issue.
Yeah, well, I never promise anything to people, and I don't raise hopes. I just say to them, this is worth trying. All right. And I have seen quite a number of cases, particularly in children with leukemia,
Okay.
that I've dealt with, mostly online. I don't always get follow-ups, but I do get follow-ups, and some of them have been extraordinary. I wouldn't hesitate. It was one of my children. Well, my children have been brought up on wheatgrass. They've never been crook, never been sick. I haven't been. I'm 80. I have never been ill in the last, I can remember, at least 40 years. I've been taking the grass for 30.
That's great.
Well, you know, it's done me very proudly. My family is very, very healthy. So, and you don't need much. And I think there's a good point there that people who take fresh wheatgrass, pull it back. Don't take so much. Just take small amounts, you know, maybe 5 mil or something like that.
Wow, that's amazing.
Some people are sort of taking liters of this stuff. And I think, well, it's really, if you look at my theory on that, you can understand why. You don't need to. The ligands that I was talking about are still in that wheatgrass. What we've done is extract those ligands. and what's the word? Increase their density.
Right.
See what I mean?
Hmm.
And it's taken me a long time, but it's been worth it in the sense that, what does I say? The response. I wouldn't be talking to you now if we hadn't done that. You know. So you're the astute person. You
Well,
should get.
I think when I see a good thing, I say I want the whole world to know about it. That's my kind of frame of reference. And this is simple, no side effects, and effective, and just with lots of data behind it. So it's a win-win and a no-brainer for people to understand. And one of the other questions they have in terms of how would you differentiate the application, or does it really matter between, say, the liquid, the balm, or the spray?
Yeah, well, this one I have to apologise about, and I have an excuse, and it's a valid one. I came from from a profession that expected to see litres rather than millilitres, right? We were talking about drug usage. We're talking about even liquid drug, etc. That's, I think, well, I don't know, but I think some of the dosages might be quite high, and I think there's sort of an encouragement to use more, and maybe it has something to do with more sales. When I started with this, I really knew nothing about the how much was necessary. I was wrong at the beginning by just using small amounts, and I'm sure that their knowledge came from probably 2,000 or 3,000 years ago, or even longer. This has been around for a very, very long time, and it's been there. The only thing that I do, I think, is concentrate more, so that you can use less when you don't need very much anyway. But when I first started off, I didn't understand that. So the products, like our larger products, I don't really want to talk about commercial stuff, but the larger tube, we're going to stop that because it's not necessary. We're getting smaller, and that encourages people to not use so much, and that will be more clearly placed on the labels. But these things take time, and so we're only a small outfit, but and we can't just chop and change and things like that. There have been a lot of changes. Gradually, we're finding the way there to the ideal product. We really only need two products, and that is the super shots. And if people are taking that, they should only take about half a capful, 2 or 3 times a week. That's what I take.
That's amazing.
And the spray is the application, should be the only application, because it's got fewest ingredients in it.
Okay.
Fewer ingredients, if you're dealing with allergies or skin conditions and things like that, you need to reduce them. But we're gradually changing that. For a small company, we don't have the wherewithal to be testing and chopping and changing and all sorts of things, and etc. And I'm trying to bring it down so that, well, you can't have a universal dosage for the extract. I don't think. I'm not sure, but my guess is that but how to get around that is a problem. But we get tremendous response. I've got, well, you can see on my website, we've got about 1,500 testimonials there, and we're not just talking about cuts and scratches. There's some quite serious conditions there. So, but does that answer the question?
Yes, it does. Thank you very much. The one of the testimonials that I actually distributed around was a video of the stroke victim who ended up driving his car within a short amount of time. And there's quite a few videos and quite a few testimonials, but I think everybody needs to understand you've certainly adopted a healing model as opposed to a business model, for sure. Volume, you're not quite the volume. You want to just be helpful to people, and that's also one of the things that I wanted to mention. for the people that are listening right now, that you spend a lot of time free to help people all over the world, especially in your part of the world, and that also really touched me as well. So I wanted to mention that and give you um, thanks to that, because you just want to be helpful, and that shows up very much in all of the work that you've done. And I think people should understand that. And there's a couple, I think, one more question that we have from our group that people are out there, and I'm going to ask you that, and then we're going to wrap it up, and then go from there, and then you can give some final statements. But here's a question we have, and I think it's from California. What can one do to reconnect the brain to the wound so the wheatgrass extract can work? So I think what this means is, in addition to the wheatgrass extract and concentrate that you're doing, do people do other things to support something that is actually quite profound, that the wheatgrass is actually unleashing the connection between the brain and the wound? In addition to that, are there any other things that you can recommend to support that process? Because that's quite profound, and that's quite amazingly powerful. Such as meditation, or exercise or yoga or anything like that.
Well, I don't use other methods. That's not to say that they don't work, but it's just that I've just concentrated on the grass, and I've just realized all this time I've been looking over here, and I'm looking straight at you, but I appear to be looking away from you. Sorry. But going back to your question,
Sure.
I think people know what's good for them. They know what's good for them, not for me to say to them what they should be doing. And it's all, I don't do it myself. To me, it's purely a therapeutic substance, and it works. And often, I'm not going to say it works every time. Of course, it doesn't. And in many patients, particularly with psoriasis, I think that that communication is often permanent. There's not much you can do about restoring that, but in some cases it will, like that young man that came back in 2 weeks, which is unusual. But I feel bad about this. I should have been. I thought I was looking at you. I was looking at you, but I'm not. I'm looking over that way.
Oh, you were fine.
Is that how it feels, Ed? Am I looking at you now?
Yeah, I think we're looking. We're perfect. We're doing great.
So it's my fault.
Oh, we're good.
Sorry, no, I'm looking that way here.
Oh, for me, you're looking just about straight ahead, so you're perfect.
I think that's why Yuka's been coming in and trying to change things.
Okay.
Yeah. Well, this has been a very, very enjoyable session, Joe, because I'll be quite honest with you. I do not. Do I know any other doctors? I know some doctors overseas that I can talk to. Yeah. But I can't. There's no one I can talk to here that I know of. But probably a few are using it. They're using it for molluscum. It's really good for molluscum.
Okay.
And that's so common, etc. But maybe I should migrate to America and sort of open.
I'm there.
Yeah. I have a son in West Virginia. He's been there for 12 years. Yeah.
Okay, great.
Cousins. I have many relations in America, so I even speak the language.
You do? Great.
Yeah.
It's not a good. Yeah, we have our accents all over the country, but I must say, when you agreed to do the interview, I was so flattered. I was just, really hoping that you would agree, and I think everybody out there listening today should understand that there are many things that can really be beneficial without side effects. And your idea that, instead of medications, which it probably in many ways disconnect the brain to the actual wound and the challenge and different things, the wheatgrass reconnects. And what could be better than reconnecting the brain to, the healing part of the body, which I think is really amazingly important. And I highly recommend people to look at your website, which is drwheatgrass.com, for all the history and the testimonials. You have done your homework on this. As a prior engineer, I appreciate all the data and different things like that. But you're doing it, you're proving it, and you got even all of these cases to show. And I think you're coming from the right space, which is also inspiring to me, and hopefully to everybody out there, that you're coming from a space that you just want to help people. And there's nothing better than that, nothing more powerful and profound than that you found something amazing and says, well, I just want to change the world and help everybody. And that's why I think that you're so inspiring to me and many others. And with that said, if there's anything else we can mention, such as the website of drwheatgrass.com, in the United States, it's called Grass Factor. I think grassfactor.com. So that's what we can do locally, people in the United States. I do think we have an international audience today, and there will be an international audience who will probably watch this replay as well. But with that said, I'd like to say thank you very much for joining this interview, for enlightening us about the profound effects. And is there anything else that you'd like to say to everyone as we wrap up our very exciting opportunity? Thank you very much. I benefit more than I think just about anybody out there. So thank you very much. And what would you like to say to everybody out there listening to you today?
Well, first, I'd like to thank you for being so very nice and friendly and interested. It makes a pleasant change for me to find people that are interested about it. I think what you're doing, I think there's a bit of a connection there. We like helping others.
Yes.
And you love seeing it get better, and it's sort of I don't know. I think it'd be nice if we all did that to each other. It'd be a friendlier place. We'd stop throwing bombs at each other.
Yeah, I think that's a great message. I mean, if our perspective is, I want you to feel better, I want to reduce suffering, that certainly would change the world. I mean, that's the way. That's how we all win.
Well, I think you're doing a fantastic job, and I thank you very much. If you want to have another chat sometime, I'm always available. I'm sort of I'm bailing out gradually, into my 90th year.
But yeah, I definitely like to take you up on that. We're going to do this again. Definitely, we'll do this again. But I think the good thing is we're not going to let you bow out so yet. But you've left quite a legacy, and I think we should all be grateful to what you've done and how you've documented it, and how you just wanted to help people. And I think with that said, I thank you again, and thank you, Yuka, for helping us out with all the technical issues, and your great team back there. So thank you very much, and hello to everyone there in Australia. It is about 10:30 in the morning, and have a great day, and take care, and I'll see you next time.
Thank you very much. Thank you very much. See you later.
Take care.
Bye-bye. Yeah. Don't forget your mask.
Thank you very much.